My name is Prisca Wanjiru Githuka. I'm a triple positive breast cancer survivor. About 11 or so years ago, when I was diagnosed with cancer, there was NHIF, the National Hospital Insurance Fund, and it did not have an oncology package. But through a lot of advocacy from CSOs, I was part of these advocacy efforts, we have now seen something happening through the defunct NHIF and even now through SHA. So we appreciate the efforts that the government is making in terms of meeting the needs of the cancer patients. However, we feel that there are some areas in which SHA is not working, and there needs to be improvement for the cancer patients to be able to receive the treatment that they so deserve. Like, for example, you look at issues to do with the cancer itself. It's very, very expensive to treat cancer, especially like HER2 positive cancer where they require Herceptin. I personally, when I was going through treatment, I had to go through Herceptin. Herceptin is very, very expensive. And so when you have a package that is capped at 400,000 Kenya shillings, or if you the 150,000 from the chronic emergency and critical illness fund, then you realize it is not enough. So we need to have the government increase the oncology package and actually try to make sure it meets the needs of the individual cancers or the specific cancers that individuals are facing. So that is very, very important. Then number two, we are having the issues of the annual payment. That is one of the things that people are talking about. Members that we work with, survivors we work with, many of them are not able to afford the annual payment. So if the government can allow patients to be able to pay in installments and not forcibly getting into the lipa mdogo mdogo, because I think people are being sort of coerced to pay through the lipa mdogo mdogo, and majority do not want to do that. So if patients can be allowed to pay like maybe on a monthly basis, that will be very good. It will help many of them to be able to meet the treatment needs. The other thing is that when patients are not able to afford, then many of them fall out of treatment, so they abandon their treatment and then they die. Because when you go to a facility and you're told that your cover is depleted, and yet you still have a long way to go, and you don't have any other source of income, you don't have support from other people, then that makes it difficult for you to be able to complete treatment. So majority of cancer survivors, they just go home and they wait to die because they don't have anything else to do. And so we really would like to call upon the government to increase that oncology package to ensure it thoroughly covers not only the treatment but even the diagnostics, because before the illness there is a diagnostics, during the illness there is a diagnostics, and even afterwards during the survivorship period there is diagnostics where patients have to go for blood tests as they go through what we call the surveillance stage of their life. They have to see the doctors every other time. So finance is a very critical issue in as far as this is concerned. I'm the vice chair of the Kenya Network of Cancer Organizations, and I'm also the founder of Pincus Cancer Support Foundation, where we deal with breast and gynecology cancers. We raise awareness on cancer risk factors, and then we also talk about the different gynecology cancers and breast cancers. Like this month of September is a gynecology cancer awareness month, so we are creating awareness on that, and we support survivors. I'm also the chair lady of the Cancer Survivors Association of Kenya.